The mindful practice of sterile technique helps protect patients from surgical post-operative infections. Asepsis in the operating room is the conscientious responsibility of each surgical team member before, during, and after surgery. This videotape and accompanying study guide demonstrate the aseptic practices during scrubbing, gowning, and gloving for operating room personnel. This videotape shows the surgical hand scrub procedure, techniques for gowning and gloving, the steps for assisted gowning and gloving, a review of the gown and glove sterile areas, and the procedure for safely removing gown and gloves. The purpose of the surgical hand scrub is to remove soil, debris, natural skin oils, hand lotions, and transient microorganisms from hands and forearms. Decrease the microorganism count on the skin. Suppress growth of the microorganism population during surgery. And reduce the hazard of microbial contamination by skin flora in the surgical site. The surgical hand scrub uses a mechanical and chemical process to control the two types of organisms that inhabit the skin. The two types found on the human body are transient and resident organisms. People acquire transient organisms by direct contact. These organisms typically attach loosely to the skin surface. During the surgical hand scrub, the mechanical friction of the scrub brush removes almost all of the transient organisms. The antimicrobial or antiseptic agent used inhibits resident organism growth. Resident organisms are the flora below the skin surface in hair follicles and sebaceous and sweat glands. They are adherent and resistant to removal. During the surgical scrub, the chemical action of the antimicrobial or antiseptic agent reduces and neutralizes the resident skin flora. Before performing the surgical hand scrub, the scrub person should observe practice guidelines in relation to the operating room apparel. These guidelines are found in the study guide that accompanies this videotape. Either the anatomic timed scrub method or the counted stroke method are used during the scrub procedure. The two methods are defined later in the videotape. Before the surgical hand scrub, the gown package containing a sterile gown and towel should be opened. Then the scrub person opens the sterile scrub brush package and positions it for easy access. Adjust the water to a comfortable temperature and flow to prevent spraying of the scrub attire. Water on the non-sterile scrub attire may soak through and contaminate the sterile gown. Wets hands and forearms. Washes with an antimicrobial agent, lathering the hands and forearms to 2 inches above the elbow. This will loosen surface debris and remove gross contamination. Cleans under the fingernails with a metal or disposable plastic nail cleaner while holding the hand under running water. Discards the nail cleaner. Washes, soaps, and then rinses hands and arms thoroughly while keeping the hands and fingers pointed upward so that water drips off at the elbows and away from the scrub attire. Removes the scrub brush from the package and applies soap from the soap dispenser or squeezes it under the water to dispense the soap. Holds the brush in one hand and cleans the nails and subungual area of the free hand. Holding Holding the brush perpendicular to the fingertips, scrubs using a back and forth motion on all four sides of each finger, including the web spaces. Scrubs the palm and back of the hand to the wrist using a circular motion. Maintains a lather. Make sure that all skin surfaces are sufficiently exposed to the friction of scrubbing and the antimicrobial agent. Continues at the wrist, scrubbing to 2 inches above the elbow on all sides of the arm, while rotating the arm from back to front. Transfers the scrub brush to the other hand and repeats all the steps for scrubbing from the fingertips to 2 inches above the elbow. During the scrub, turn off the water when not needed. Discards the brush and rinses hands and arms under running water, starting at the fingertips and working toward the elbows, keeping hands upright and elbows in a downward position. With fingers and hands pointed upward and away from the scrub attire, the scrub person enters the operating room using their back to push open the door. The scrub person will use either the anatomic time scrub or the counted stroke scrub. As the names indicate, the anatomic time scrub times the scrub of each area. The counted stroke scrub counts the strokes for each area. The scrub person should follow their facility's policy. The anatomic timed scrub is for 5 minutes. This provides a 2.5 minute scrub per extremity. The fingers and nails are scrubbed for 30 seconds. The palm and back of the hand for 1.5 minutes. And the wrist to 2 inches above the elbow for 30 seconds. Repeat these timed scrub steps for the other extremity. In the counted stroke scrub, the number of strokes are counted for each extremity. The nails for 30 strokes. All sides of each finger for 20 strokes. The back of the hand for 20 strokes. The palm for 20 strokes. And each third of an arm to 2 inches above the elbow for 20 strokes. Repeat the counted scrub strokes for the other extremity. If any part of the hands or arms inadvertently touches the sink, add 10 strokes to that area of skin to correct the contamination. The scrub person must thoroughly dry their hands and arms before donning the gown to prevent organisms on the wet skin from strike-through and contaminating the scrub attire. The scrub person will pick up the sterilized towel without dripping water on the gown and move away from the table. Keep the towel away from the non-sterile scrub attire by bending forward slightly. Hold up one end of the towel and let it open full length. Use 1/2 of the towel for one hand and arm, drying the hand first. With a rotating motion of the arm, pat the skin up to 2 inches above the elbow. And with the dried hand, carefully reverse the ends of the towel and dry the other hand and arm with the unused half. Discard the towel. To don the gown, lift the folded gown directly upward from the sterile package. Step back from the table. Carefully locate the neckband and hold the inside front of the gown just below the neckband with both hands. Let the gown unfold while keeping the inside of the gown toward the body, without touching the sterile exterior of the gown with bare hands. And hold the hands at shoulder level, away from the body, and slip both arms into the armholes simultaneously. The hands remain inside the cuff. It is important that the circulating nurse know their role in the gowning procedures. The circulator may assist by reaching inside the gown and pulling the inside seam, and touching only the ties or snaps, secures the back of the gown at the neck and the waist. To don the gloves with the closed glove technique, the scrub person will use their right hand while keeping both hands within the cuffs. Grasp the folded cuff of the left glove. Hold the top edge of the cuff in the left hand above the palm. Place the palm of the glove against the palm of the left hand. The glove fingers point up the forearm. Grasp the back of the cuff in the right hand and turn it over the end of the left sleeve and hand. Hold the top of the left glove and underlying gown sleeve with the covered right hand. Pull the glove over the extended left fingers, pushing the hand through the glove until it completely covers the cuff of the gown. And then glove the right hand in the same manner by reversing hands. The open gloving technique is used during a surgical procedure when one or both gloves must be changed without assistance. This technique is also used when performing sterile procedures, such as bladder catheterization or insertion of an IV cut-down. To change gloves during the procedure using the open gloving technique, the scrub person should step away from the sterile field. The circulator removes the contaminated glove. The scrub person picks up the glove under the cuff with the uncontaminated glove hand. Inserts the hand into the glove and pulls it on, leaving the cuff turned well down over the hand. Avoid inward rolling of the cuff. The bare hand does not touch the outside of the glove. And rotates the arm and pulls the cuff of the glove up and over the sleeve cuff, letting the gloved fingers touch only the outside of the other glove. A scrub person may assist another member in drying, gowning, and gloving. The scrub person will open the towel that the other member will use to dry their hands. Lay the towel on the team member's hand without touching their hands. Hold the gown at the neckband and carefully unfold it. Keep the hands on the outside of the gown, forming a protective cuff of the neck and shoulder area, as the person being gowned holds both arms outstretched. Offer the inside of the gown to the other member so they can slip their arms into the sleeves. And release the gown when the team member's hands are in the sleeves. The circulating nurse reaches inside the gown and pulls the inside seams. The scrub person adjusts the sleeves so the cuffs fit properly. To glove another team member, the scrub person always gloves the other person's right hand first. The scrub person picks up the glove with their fingers under the averted cuff. They hold the palm of the glove toward the person being gloved. The scrub person stretches the cuff to open the glove while holding their thumbs out to keep them from touching the other team member's bare hands. As the other person inserts their hand into the glove, the scrub person exerts upward firm pressure, making sure the hand does not go below the waist. Then the scrub person unfolds the averted glove cuff over the cuff of the sleeve. Assists the gloving of the left hand by repeating the steps. And holds the tie as the other team member turns when a wraparound gown is used. The surgical team must observe precautions to avoid contamination and maintain the sterile field. The hands should be kept above the waist and in sight at all times. The sterile areas are the front of the gown from the table level or sterile field to 2 inches below the neck. The sleeves from 2 inches above the elbow to the cuff. And the surgical gloves. If any part of the sterile attire becomes contaminated, immediate corrective steps must be taken. For instance, if a glove becomes contaminated or perforated during surgery, it must be changed immediately. At the end of the procedure, the gown is always removed before the gloves. To prevent contamination of the wearer's scrub attire, the circulator unfastens the neck and back closures of the gown, and the wearer then grasps the shoulders of the gown, pulls the gown downward from the shoulder and off the arms, and turns the sleeves inside out, and discards the gown in the appropriate receptacle. As the gown comes off, it usually turns the cuffs of the gloves down. To remove the gloves, the wearer can use a glove-to-glove and then the skin-to-skin technique. This approach protects the hands from the contaminated glove. The wearer grasps under the cuff of the left glove with gloved fingers of the right hand and pulls it off inside out. They slip the ungloved fingers of the left hand inside the right glove and then slip it off inside out. They discard the gloves in the appropriate receptacle and wash their hands with soap and water. The aseptic principles for scrubbing, gowning, and gloving prevents contamination to the surgical wound and helps control infections. It is the individual responsibility of each surgical team member to conscientiously practice these principles for the safety of their patients.
In nature, all living things are part of their environment, and the environment affects the survival and well-being of its inhabitants. In many situations, the environment can be controlled to provide a maximum benefit for a specific population. In the hospital, the operating room environment is one that must be controlled. It's designed to ensure maximum benefits and safety for every surgical patient. The concepts and principles of aseptic technique are used in creating and maintaining that environment. An effective method of controlling infection in the operating room is through the use of aseptic technique. Aseptic techniques are the methods used to maintain asepsis. Asepsis is the absence of disease-causing microorganisms. Surgical aseptic technique is creating and maintaining a controlled environment free of bacteria, viruses, and fungi. This is also called sterile technique. Sterile means being maximally free of all microorganisms. Sterile field is the area and people immediately around a patient that have been prepared for a sterile procedure. Microorganisms can come from two main sources: endogenous sources and exogenous sources. Endogenous microorganisms are normally found within the body. These may cause infections when the patient's own body defenses are low. Factors that increase patient susceptibility to endogenous infections include malnutrition, age, obesity, chronic disease, and impaired defense mechanisms. The nurse can help defend the patient against microorganism invasion by using aseptic techniques in preparing the skin, inserting a catheter or monitoring device, or starting IVs. Patients can also be infected with exogenous microorganisms that are outside his or her body. Safeguarding the patient from hospital-acquired exogenous microorganism infection can be accomplished in many ways. Controlling traffic in the surgical suite is one way. Traffic patterns for specific areas are defined in AORN's standards and recommended practices. Unrestricted areas, where street clothes can be worn, include control points where the suite interfaces with the rest of the facility. Semi-restricted areas are the peripheral support areas within the OR suite. These include, but are not limited to, storage, work areas, and corridors. Here, scrub attire and caps are worn. The restricted area requires full operating room attire, including masks. These areas include the clean core, substerile areas, and operating rooms. Another environmental factor is the control of air currents. Effective air ventilation and filtration, unidirectional air currents, and laminar flow rooms decrease airborne contamination. While air turbulence created by opening doors, fanning of linen, excessive numbers of people in the OR, incorrectly worn face masks, and excessive talking may all increase microbial numbers. Environmental sanitation is also a factor in preventing transmission of exogenous microorganisms. Germicidal cleaning solutions used in environmental sanitation destroy microorganisms. Germicidal chemicals that kill most viruses, bacilli, and fungi are called disinfectants. They are used on inanimate objects. There are three main methods used in cleaning the OR. Concurrent cleaning is the ongoing cleaning immediately after the discharge of infectious material. End-of-case cleaning is performed between surgical cases. Terminal cleaning can be done following the final procedure of the day. All of these factors are important in controlling the operating room environment. However, people are the major source of contamination. The primary factor in controlling exogenous microorganisms is adequate washing of hands before any patient intervention using antimicrobial solutions. The surgical team is responsible for isolating microorganisms by their practice of aseptic technique. The foundation upon which aseptic technique is built lies in the surgical conscience of every person in the OR. Surgical conscience is knowing and adhering to the principles of asepsis and sterile technique at all times. Each person's behavior and actions are guided by their internal beliefs and attitudes. Therefore, when one has a surgical conscience, performance of aseptic technique is consistent, whether the person is alone or observed. The person with a good surgical conscience must also have self-discipline, good anticipatory skills, and the maturity to perform correctly in every situation. Knowledge of concepts and principles of aseptic technique is essential for controlling the operating room environment. There are 8 principles of aseptic or sterile technique. Principle number 1. All items used within a sterile field must be sterile. There are many ways to kill microorganisms to provide sterile instruments or supplies. Sterilizing agents include steam, ethylene oxide gas, liquid chemicals, dry heat, and radiation. Sterile items are kept in closed storage located in appropriate areas. These instruments and supplies may be packaged in a variety of materials, which can be reusable textiles, non-woven fabric, plastic, or hard containers. Packaging material must allow sterilizing agents to penetrate its contents, while providing a barrier to environmental microorganisms. The length of effectiveness of package sterility, also called shelf life, is event, not time, related. Storage area conditions, methods of handling, and type of packaging are some variables which determine the length of effectiveness. Each sterile package must be inspected for integrity before being opened to ensure that its contents have not been compromised by holes, punctures, rips, or moisture. To comply with external regulations, an expiration date is marked on all internally processed materials. Some commercially packaged materials may be marked with either a date of manufacture or sterilization expiration. Sterility process monitors indicate a package has been exposed to the sterilization process. Monitors can be inside or outside of the package and can be discs, tablets, solutions in small containers, or chemical tape. Always check the following before opening a sterile package: the integrity of the package, the expiration date, and the sterility process monitors. Principle number 2. A sterile barrier that has been permeated must be considered contaminated. Sterility can be compromised if permeable materials are used. When moisture soaks through a package, it's called strike-through. Any article that has become wet is considered contaminated, even if strike-through cannot be directly observed. Many of today's materials are fluid-resistant and antimicrobial, but may be punctured or torn. If a sterile barrier is mechanically disrupted, for example, a needle puncturing a glove, a surgical conscience will demand the situation is acknowledged and corrected. Hard container systems should have intact filters. Principle number 3. The edges of a sterile container are considered unsterile once the package is opened. These boundaries are hypothetical and are safety margins. The boundaries should be maintained in an aseptic environment to prevent accidental contamination of a sterile field. In opening large packs, the cover becomes the barrier to create the sterile field. With some commercial packs, place your hand under the fold of the material. Open the back and then the front flap. Each side flap should then be opened. Care should be taken to walk around the pack and not reach over the sterile field. When opening small packages, open the far side first and the near side last. Secure the wrapper tails so they will not spring back and contaminate the sterile item. Extend the contents toward the sterile person so he or she can lift it away from the package cleanly without touching the wrapper sides. In opening peel packs, separate the edges by rolling them back over your hands. The sterile contents can then be offered to the scrub person in a way that minimizes the possibility of touching the unsterile edges. When opening solutions, remove the lid by lifting it straight off. This prevents accidentally contaminating the edges. Pour the solution carefully to prevent splashing or touching the sterile field. Do not allow solutions to run down the bottle and drip onto the sterile field. Once opened, all the solution must be dispensed in a single delivery. Any unused portion must be discarded. Principle number 4. Gowns are considered sterile in front from shoulder level to table level and the sleeves to 2 inches above the elbows. Gowns are considered sterile until they're put on. Once hands touch the stockinette cuffs, the cuffs are considered unsterile and all must be covered with sterile gloves. Sterile persons should keep their hands close to their body in front of them and only within the designated sterile area of the gown. The back of a wraparound gown is considered unsterile because it cannot be constantly observed. Principle number 5. Tables are sterile only at table level. Drapes that hang over the sides are considered unsterile because they're out of sight and cannot be monitored. Scrubbed persons should not allow their hands to fall below the sterile field for the same reason. A scrubbed person should sit in a sterile area only to perform a surgical procedure and should remain seated for the entire procedure. Principle number 6. Sterile persons and items touch only sterile areas. Unsterile persons or items touch only unsterile areas. Unscrubbed persons must be careful to maintain enough distance from a sterile field to prevent contamination. Unsterile people should always face the sterile field and should not walk between 2 sterile fields. Unsterile persons should not lean or reach over sterile areas and should always maintain a distance of safety to prevent accidental contamination. A safety margin must be maintained, either by space or by using an instrument for extension. Principle number 7. Movement within or around a sterile field must not contaminate that field. Sterile persons must remain within the sterile field. When exchanging positions, movement must be back to back or front to front. Principle number 8. All items and areas of doubtful sterility are considered contaminated. An item is either sterile or it is not. Any questionable item is considered unsterile. A good surgical conscience is vital in maintaining a sterile field. Sterile fields should be prepared as near as possible to the start time of the surgical procedure. A sterile field must be constantly monitored. Unguarded fields should be considered contaminated. It is the responsibility of all members of the surgical team to maintain a sterile field. Operating room personnel must acquire the knowledge and develop skills needed to control their environment. They also need to have the surgical conscience to continuously apply these basic concepts and principles. Principle number 1. All items used within a sterile field must be sterile. Principle number 2. A sterile barrier that has been permeated must be considered contaminated. Principle number 3. The edges of a sterile container are considered unsterile once the package is opened. Principle number 4. Gowns are considered sterile in front from shoulder level to table level and the sleeves to 2 inches above the elbows. Principle number 5. Tables are sterile only at table level. Principle number 6. Sterile persons and items touch only sterile areas. Unsterile persons or items touch only unsterile areas. Principle number 7. Movement within or around a sterile field must not contaminate that field. Principle number 8. All items and areas of doubtful sterility are considered contaminated. Responsible actions and awareness of aseptic techniques by hospital personnel will give the patient a better chance toward remaining infection-free from the surgical intervention.
Prehistoric bones show that even in remote times, man was performing surgery using instruments like sharpened